The Coalition's mission is to promote effective interchange among patients, families, and healthcare professionals and payers to ensure the provision of patient-centered care.
Well, supportive care is exactly what it sounds like. It's a critical layer of support for our patients, their loved ones, the medical teams that are taking care of them. And specifically, it's about really re-empowering people in a health system that tends to make people feel more disempowered.
Hi, I'm Dea Lupu. I'm faculty at George Washington University. My whole professional life, I've devoted myself to trying to improve supportive care and end-of-life care for people, for my friends, for my family, for people I don't know. What I've focused on in particular is how do we improve that last chapter of people's lives? How do we help them write the chapter that they want to write? Because the end of the story matters.
As a younger, early career nephrologist, I wasn't aware of patient-centered care or how I could really talk to patients and learn what's most important to them and treat them according to their wishes. And really becoming more interested in palliative care made me understand the importance in the physician-patient relationship of really talking to patients and learning their values and their goals, what treatments they would want, what treatments they wouldn't want.
To me, supportive care is about being able to tell your story and maybe some of the grim parts of that to professionals who can tolerate some of that and also have some skill in helping alleviate those sort of things. So not just, again, the physical symptoms, but the emotional things that happen. It's about recognizing that when illness strikes, that oftentimes entire families suffer, and that if we really want a patient to stop suffering, we also have to support their family in that as well. I think supportive care is also about talking about what are the elephants in the room, if you will.
So everyone's in this dance around the elephant in the room, which is not necessarily, sometimes the elephant is mortality and death, but sometimes the elephant is just, I might be getting sicker, I might not be able to do what I wanted to do, or dementia is progressing, and what is that going to mean, and what is that going to be like, and will my wife be able to take care of herself without me helping? And so these are the concerns that people have who have kidney disease.
My concern is that some patients, especially older patients, those with multiple comorbidities, may suffer a great deal while they're on dialysis, and many of them didn't even know that they had an option other than going on dialysis. Many research studies have indicated that patients didn't realize that they had a choice and that there was something called active medical management without dialysis, especially for your elderly patients who really have a little bit of cognitive impairment or significant functional decline.
I began my nursing career in dialysis, but I also worked in hospice for a short time early on. I went back to dialysis. But some years later, the manager of the hospice company reached out to me and asked, "Hey Lynn, what's your referral process for dialysis patients to hospice?" And I didn't really know how to answer. We didn't have a process.
We're dedicated to improving the lives of kidney patients by providing patient-centered supportive care education, best practices, implementation, and technical assistance to kidney care teams across the United States.
We can hope that these medical treatments are going to sustain you for a long time and that you're going to feel well, but often we know that they don't sustain people forever, or that the kind of burdens of treatment will be very difficult for people to bear. That can happen. And so having a plan B, having a plan in case this isn't going how we hope.
To me, supportive care is about seeing beyond the disease. So rather than, checking out what's wrong with a particular organ and fixing it, supportive care is really about trying to understand the impact of the disease on the person and their life. And so one of the things I love about supportive care is the emphasis on the whole person, the understanding that in order to alleviate suffering, I have to really understand what it's like to be you.
I hope that the tools that we're developing and the research that we're doing is going to provide people with the best care, and that we can help distribute these tools and resources so that everyone has equal access.
And so when I heard about this Pathways project and its vision, it immediately reminded me of this conversation that I had. And that's when I knew this was an opportunity for change within our culture.